We've all been there. That scratchy, painful feeling that seems to come out of nowhere. It makes swallowing a chore, turning even the simplest act of drinking water into a painful task. Even talking can be uncomfortable, making it hard to communicate with others. A sore throat is one of the most common reasons people see a doctor, seeking relief from the discomfort. But did you know that most sore throats are not serious? They often resolve on their own without medical intervention. In fact, most sore throats are caused by viruses, not bacteria. This means they usually don't require antibiotics. Antibiotics only work against bacteria, so they won't help if your sore throat is viral. Taking antibiotics for a viral sore throat won't help you get better. It can lead to unnecessary side effects. It can actually do more harm than good, contributing to antibiotic resistance and other health issues. So how can you tell if your sore throat is caused by a virus or bacteria? It can be tricky. Many symptoms overlap. Viral sore throats are often accompanied by a runny nose, cough, and congestion. Bacterial sore throats, on the other hand, may come with a fever, swollen glands, and white patches on the tonsils. Doctors use a tool called the Centor Criteria to help determine the cause of a sore throat. This is particularly useful in distinguishing between bacterial and viral infections. This tool looks at 5 different symptoms. Each symptom gets a point. Adding up the points gives you a score. The higher the score, the more likely it is that you have a bacterial infection. Fever, a temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher earns a point. This is a common sign of infection. Absence of cough. If you don't have a cough, you get a point. This is because a cough is more commonly associated with viral infections. Swollen lymph nodes. Tender swollen lymph nodes in your neck mean another point. This indicates your body is fighting an infection. Tonsillar exudate. White patches or pus on your tonsils add a point. This is a strong indicator of a bacterial infection. Age plays a role. If you are between 3 and 14 years old, you get a point. This age group is more susceptible to bacterial throat infections. If you are 45 or older, you actually lose a point. This is because older adults are less likely to have bacterial throat infections compared to younger individuals. What your Centor score means. Your Centor score helps your doctor determine the likelihood of a bacterial infection. A score of 0 or 1, a bacterial infection is very unlikely. Antibiotics are not usually needed. A score of 2 or 3, a bacterial infection is possible. Your doctor may consider antibiotics based on your symptoms and medical history. A score of 4 or 5. A bacterial infection is highly likely. Your doctor will likely prescribe antibiotics. The NICE Guidelines. The National Institute for Health and Care Excellence, or NICE, provides guidelines for doctors in the UK. These guidelines recommend a cautious approach to antibiotics for sore throats. They emphasize reducing unnecessary antibiotic use. Overuse of antibiotics leads to antibiotic resistance. This means the drugs become less effective at fighting infections. This is a serious global health threat. Soothing your sore throat, home remedies that work. Sore throats can be quite uncomfortable, but the good news is that there are several effective home remedies that can help alleviate the pain and discomfort. Most sore throats go away on their own within a few days, but during that time, the discomfort can be quite bothersome. Here are some tips to ease the discomfort and help you feel better faster. Stay hydrated. Drink plenty of fluids such as water, broth, or herbal tea. Staying hydrated helps keep your throat moist and can reduce irritation. Warm liquids in particular can be soothing. Gargle with salt water. Mix a cup of warm water with a teaspoon of salt and gargle for a minute or 2. This simple remedy can help reduce swelling and discomfort in your throat. Lozenges and hard candy. Sucking on lozenges or hard candy can help moisten your throat and provide temporary relief from pain. Choose ones with soothing ingredients like menthol or eucalyptus. Honey. Honey can coat and soothe the throat. Add it to tea or warm water for a comforting drink. Honey also has natural antibacterial properties that can help fight infection. It's important to remember that if your sore throat is severe, doesn't improve after a few days, or you have other concerning symptoms, consult your doctor. Persistent sore throats can be a sign of a more serious condition. They can provide the best guidance for your situation and recommend appropriate treatments. Remember, antibiotics are powerful tools but should be used responsibly. They are not effective against viral infections, which are the most common cause of sore throats. Always follow your doctor's advice regarding their use. Thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more health tips. See you next time.